Beauty Booster Injection Device with PRP Treatment Protocol. The supplies needed for a Beauty Booster treatment with PRP are a 3 or 5 ml syringe of the patient's PRP, a Beauty Booster kit. Your Beauty Booster kit includes large side filter, cotton bowl filter, blue lure adapter, 9-point needle. Additional medical supplies needed: gloves, stanhexidine, gauze, sharps container, pain management if required. Make sure that your patient has signed a consent form and has been given post-care instructions. Please visit the Clarion Partner Portal for sample consent, pre- and post-care forms. Make sure to take before pictures so that you can monitor the patient's progress through the treatment series. A topical numbing can be applied to the patient's skin 30 minutes to 1 hour before treatment. Another great option is the use of Pronox. Please contact your local consultant for more information. For the treatment today, I'll be applying a topical numbing. While the numbing is taking effect on the patient's skin, begin preparing the platelet-rich plasma and the Beauty Booster device setup. Preparing the patient's PRP. Draw the patient's whole blood, place WorldPRP tube in the centrifuge to separate components, and extract the platelet-rich plasma in a 3 or 5 ml syringe. Beauty Booster device setup for treatment. Insert cotton bowl filter located on the bottom of the device. Locate the side filter inlet/outlet and insert the large side filter. Attach the blue lure adapter to the tip of the 3 or 5 ml syringe containing platelet-rich plasma. For this demonstration, I am using a 5 ml syringe of PRP. Connect the 9-point needle to injector. Do not remove the blue safety guard, only remove the blue safety guard when the syringe is securely connected to the needle. Unpack the 9-point needle from its packaging. Grasp the needle between the thumb and middle finger with your index finger on the top of the 9-point needle to hold the blue safety guard in place. Line up the bottom of the 9-point needle with the opening on the injector and push down. Once the needle is secure, double check to make sure the lure connector is aligned and secure in the U shape on the injector. Place the syringe on the injector and secure the plunger into the position holder. To adjust the position holder, use the back arrow button or the forward arrow button located on the injector. Insert the syringe with the blue lure lock to the lure connector on the 9-point needle. Secure the plunger into the position holder. Slightly push the syringe to ensure a tight connection. Remove the blue safety cap. Press the forward arrow button on the injector until the product runs into the lure connector. Using the syringe screw dials, fasten the dials at both sides. Patient treatment selection settings. Select the syringe size. For the patient today, I will be using a 5 ml syringe with a platelet-rich plasma preparation. Select your depth. I am using a depth of 1 mm for the face and 0.8 mm for around her eyes. Select your speed. Recommended speed for Beauty Booster injection device treatment with PRP is between 4 and 5, patient dependent. PRP has a thin consistency, which means the needles will need to remain in the skin longer, allowing the PRP to be dispersed before retracting. Select your dose in microliters. Recommended dose is 20 microliters to 30 microliters. I will be using a dose of 20 microliters. Select your vacuum setting. Make sure that your vacuum setting for the Beauty Booster PRP treatment is turned off. The vacuum ranges from 1 to 5. 1 is off. Press the start button located on the injector to turn the device on. Using a piece of gauze, pull the trigger a couple of times to remove the remaining air inside the syringe and to confirm the patency of all 9 needles. Your Beauty Booster device is now primed and ready for treatment. Patient preparation. Cleanse the patient's skin and make sure to remove all topical numbing. I'm using Teoxane's micellar solution. Micellar solution contains a special blend of powerful hydrating and soothing ingredients, which cleanses away impurities and makeup. Follow with a cleanse using stanhexidine prior to injection. Beauty Booster treatment protocol. Divide the patient's face into thirds, roughly 33 injections in each section. Our objective at this time is to completely blanket the face with the PRP to improve skin texture, promote more vibrant and youthful look, build new tissue, promote collagen production, resulting in fewer lines, wrinkles, and plumper looking skin. Hold the injector at a 90-degree angle, ensuring full contact of the 9-point needle on the patient's face. Apply slight pressure and pull the trigger. The unique 9-point multi-needle system maximizes the efficiency of delivery in the treatment area, ensuring accurate and even distribution of the PRP preparation, combining the effects of microneedling such as neocollagenesis and the benefits of PRP. A series of 3 treatments, 3 to 4 weeks apart, is recommended for optimal results. For maintenance purpose, the treatment can be repeated 2 to 3 times per year or as desired. Once you've completed all 3 sections, use the micellar solution to remove any pinpoint bleeding off the patient's face. The micellar solution will soothe and hydrate the patient's skin. It also contains chlorhexidine at less than 1% concentration to ensure prevention of bacterial proliferation. Add more PRP to the patient's face topically, just like you would a serum. Allow that to dry for a few seconds. On average, patients should experience a minimal downtime. Some patients may have bruising and blotchiness post-treatment, which will usually settle after 4 days. Apply Teoxane's post-procedure to the patient's face. It contains ingredients such as Nutrazine TM, which will reduce the signs of inflammation, calm, and soothe the patient's skin. It also contains arnica, which will aid in reducing any bruising. Now I'm going to be applying the Color Signs Finishing Touch Protocol to our patient. The Color Signs Finishing Touch Protocol can be incorporated as part of your patient's treatment. There are several procedures that hundreds of our top practices are incorporating the Finishing Touch Protocol, and they include laser resurfacing, microneedling, injectables, chemical peels, IPLs. Layering and reapplication are important elements to successfully protect yourself daily from harmful impact of environmental exposure. As I do the application, Karen, I'm going to walk you through the steps so that when you're at home, you will feel confident on how to use the Color Signs products. In the morning, after you've applied your regular skincare, you're going to apply All Calm Clinical Redness Corrector. So what you're going to do is put 1 pump onto your fingertips, warm it up for about 5 seconds between your fingertips. Then you're just gently going to pat that into your skin, making sure you are applying it evenly. Once you've applied the All Calm, you're going to use this other multifunctional product that treats, corrects, and protects, Total Eye Renewal Care. You're going to do half a pump and then apply 3 dots under both eyes and on top of both eyelids. Once you have spread the product, using your ring finger, you're going to lightly press the product in, ensuring that you have applied it evenly. This will give you instant brightness and a physical sun protection. Now I'm going to move on to the Mineral Corrector palette. This palette has 5 neutralizing shades to correct a look of imperfections such as areas of more redness or pigmentation spots. There's a little cheat sheet on the back for you to use. This indicates what each color is for. I recommend a mix of the first 3 colors for your skin tone. Next, for continued sun protection, you will want to reapply your Sun Forgettable Brush on Shield at least 3 to 4 times per day. This brush is going to be your tool for reapplication. Reapplying every 2 hours is key to successfully staying protected. Right now, I'm going to be applying the Sun Forgettable powder with a gauze. Now I'm applying the Lip Shine product. This will give the lips an extra boost of hydration and an added layer of protection as it has an SPF 35, with a fresh pop of color to your lips. Last but definitely not least, I'm applying the Hydrating Mist for a boost of hydration to set the mineral protection I have just applied to your skin.